All right. Good good evening, good night, everyone.
Good evening.
Good to be with you. Wendy and I, we greet you in the spirit of 3rd John 1, verse 2, that you prosper in good health, even as your soul prospereth. Um, as we did the last time, our discussion will be focused on health, and the topic uh, is a question of sorts coming from a statement that most of us are familiar with. And the statement goes a little like this: health is wealth. And the question we ask this evening is health wealth? Um, Now, just a few disclaimers and definitions as we go through this evening. Um, in the discussion, we use the term conventional medicine, and we quite likely use the term functional medicine. Conventional medicine refers to um, the practice that we're most accustomed to, where we go and see our doctors and we get prescribed medication um, to deal with any ailments that we might have, hospital setting, primary, secondary settings, and so forth. And then we might mention functional medicine, which actually looks at the root cause of a particular problem or particular issue and seek to address the root cause, thus reversing, in many cases, the disease condition. So you might hear those terms well, not interchangeably, but you might hear those terms being used. So what we're going to do today is kind of have a discussion back and forth. We'll kind of bring you into our world. As you already know, we are in the healthcare field. And between us, we have these discussions about topics, about disease, about ideas, and so forth. So we're just going to bring you into our world as we look at the question: is health wealth? Um, did I cover all the disclaimers?
Yeah, I mean, as we go along, we can continue
All right.
disclaiming.
All right, perfect. So we're going to start off by addressing a comment someone made in dealing with that question: is health wealth? And the comment that the individual made was, or the statement made was, I am not going back to a doctor because all they want to do is prescribe medication.
Is
All
that
right.
familiar?
That was the comment.
Yeah.
Now, the first question is that a valid comment?
It is a
Is there
valid
some
comment.
validity in that statement?
It is a valid comment. I hear that comment quite a lot, whether I'm in the clinical setting or I'm not, because people tend to think that the physician, instead of actually finding out what's going on, they're quick to prescribe. And I hear that a lot in the clinical setting and outside of the clinical setting.
So, and I think the person was actually referencing conventional medicine.
Yes, conventional medicine, because that is where we are taught to actually diagnose and prescribe, as we mentioned before in the last discussion. We're actually trained to diagnose the condition. You manifest a symptom, there's a symptom, there's a sign, there's a symptom, come up with a diagnosis, and then prescribe if warranted. That's conventional, really.
All right. Now, are there options? I imagine the statement that this person made seems to suggest there is some frustration with the system, conventional medicine, and therefore wanted something else. What
Right.
what are the options there? based on that statement?
So this is a frustration that is voiced by a lot of our population, members of our population or community, because deep down within the patient feel as if something else could be done. Even if they don't know what it is, that statement, because all they want to do is prescribe med, it's sounding the alarm that I think there's something else that could be done. But what? They don't know, and they're not getting the answer. So, and here enters functional medicine. And this functional medicine is nothing new. It's really nothing new. Functional medicine is asking what is really going on with you on a biochemical level. What is causing your sign and your symptom? Why? What? Simple.
So
that's it.
So what do you think patients want from a practitioner, from a provider, from a clinician, from a doctor? What do patients want?
Oh man. So, okay. All right. Patients, let's say patient enters the room. Let me give you a real life scenario. And if you're a patient yourself, you can attest to this. Patient enters the room, they're gonna make contact. Let's say you're coming in to see a provider for the very first time. You're gonna make contact because there has to be a relationship. Now, if I come in to the room and I'm not engaging, I'm stuck on the computer, even if I'm paying attention, the computer is an integral part of our documentation process and a vital part of healthcare. But let's say I have the computer, I'm stuck with my face in the computer. They're asking the patient, what's going on? And in my mind, I'm formulating the answer in order to treat, but I'm not getting into the nitty-gritty, paying attention to the patient, looking in their face, finding out what's going on, watching their body language, listening to the patient who knows their body best, right? In order to find out what's going on. So sometimes these frustrations are coming from even being in the presence of a frustrated practitioner as well. We're just trying to move from one patient to the next.
Right. So then the patient wants to be heard. In addition to being treated for whatever condition they're in, but being heard is a part of it.
Acknowledged and heard.
Excellent. Now, so going back to that statement that was made about prescribing medication, would you say that there is a heavy emphasis on prescribing medications over prescribing medication to manage a disease process over reversing and healing?
So look at it now, honestly. Okay, so we have to be realistic. Okay, we have to be so realistic. You have to take into consideration in healthcare, we call it social determinants of health. Where's the patient coming from, his background, economic, financial, health, even psychological, so everything. We have to look at the entire picture. I'm going to get up and say, okay, we've got to do this and do that. This is what's going on. We have to be very careful. So conventional medicine has its role as well as functional medicine. We now have to be the artist and the scientist in order to determine what will be best for the patient. Is functional better? It is. But at the same time, you've got to think now that not every patient is in this situation that they'll be able to actually listen to you because of their pockets are tight, and they'll be able to afford the type of food that you're going to tell them to eat. So we've got to just honestly be realistic when taking care of our patients and our population. Because functional medicine, okay, so let me give you an example. Like even today, patient walks in, and of course, like today, I don't have to call any name because of HIPAA. But today I had a 20-something-year-old patient with a body mass index of 50. That's a very young person with a body mass index of 50. And according to science, We're not really agreeing anymore. We have passed the BMI stage, but our BMI should be at least between, let's say, 19 to 24 BMI. You know, that's a healthy body, although we're trying to get rid of that body mass index now. It's so archaic. But hers was 50, right? And she's like, I've done everything, I've tried every diet, I've done everything, and I can't shake the weight. What am I going to tell this patient? To go home and eat vegetables? To exercise? What am I going to tell this patient right now? So functional medicine now. So what I did, I'm in a conventional setting. So I'm like, okay, let's say that her name is Mary. And I say, Mary, I've got to look to see what's causing your weight gain. First, I've got to look at your genetics. Tell me about mom and dad, what's going on with them. Tell me about what you're eating. And I'll have to do some blood work in order to see if which hormone is out of balance. That right there is functional medicine. So instead of like maybe giving her a weight loss med, which of course I did too, because she was like really asking for it. And I had to be realistic because honestly, to be able to afford what I'm offering would be really too hard. So I'm like, instead of saying you've got to go to Stop and Shop or Shop Right and get this and get that, I have to give her the medication. But I also have to do blood tests so I can point out and educate Mary, like, Mary, let's look at how hard your pancreas is working though. Let's look at your A1C to see if you're pre-diabetic. Let's see if your pancreas is producing too much insulin. So we got to look at your insulin level. Let's look at your cholesterol level, right? Let's look at your even leptin, that hormone. Let's look at your leptin level. So that is functional medicine now. We're seeking to understand what's going on with Mary's body, why she's so morbidly obese, and then try to reverse it.
All right. So you brought up type 2 diabetes.
Mm-hmm.
So let's look at that, for example, in the conventional setting, going back to that question, the approach is to medicate first.
Yes. Yes.
And what you're saying is, to some extent, that is valid because you need to control the situation, control the disease process for short term.
For short term.
The problem is, we get stuck. Some patients get stuck in that mode, and the medication continues for an extended time. Instead of control,
we manage
and manage and reverse.
Reversing diabetes is functional medicine. Reversing type 2 diabetes is functional medicine. So when my patients come in, I tell them, listen, this is your hemoglobin A1C. The A1C is a test that we do to look at how much sugar is sitting on that red blood cell for about 3 months, because the red blood cell lives for, its lifespan is about 3 to 4 months, right? So we look at the amount of sugar that's sitting on that red blood cell over 3 to 4 months. That's the hemoglobin A1C. So we look at the A1C and we're like, oh my, your A1C is 7% today, because over 6.7, that's diabetes. We are looking at the A1C. Now, if my patient comes in and the A1C is 7, and in 3 months I test it again, and I gave them metformin, and in 3 months I test it again, and they're like, Wendi, I'm doing everything, and it's gone up to 8, I'm going to increase the metformin. And in another 3 months, if they come back and it's gone up, I'm going to increase. So I tell my patients, don't you see that if the medications were going to get you better, the A1C would have been reversed, would have decreased.
Right. So then, so it's unusual. There are some conditions that require this management.
Oh, yes.
And there are some conditions in which reversal is possible. But here is the question, going back to the original, is health wealth.
It is.
Now, if anybody who is most people who attain wealth or acquire wealth, there's some amount of sacrifice.
Yes.
99% of the time, there is sacrifice to begin it, unless you inherit.
Yes.
Unless you inherit.
Right.
So in this case, if we're saying, I guess by this point, we're saying health is wealth. It's just how much emphasis we put on that. Now, is managing the disease, and we're going back to that example that you started with, type 2 diabetes, is managing that disease or any disease, any of the metabolic diseases, is that hard work?
For me?
For anybody.
For the patient?
For any patient to manage it. So a patient comes in with type 2 diabetes, which we're not talking about type 1, where it is a autoimmune disease. We're talking about the state in which the body is based on our practice, eating practice, health practices that has gotten to this stage. It is hard work.
It is hard work.
To reverse it.
It is hard work. It's a complete 180 change of mind. It is hard work, but if our patients, you see, what I've realized, if our patients, as a provider, if we explain and break it down, break the science down to the nitty-gritty for our patients so they can understand it. And when they get the picture and the light bulb goes off and they say, oh, that's why. That's when learning has taken place. That's when they're motivated to change. So it is hard depending on how we explain the science to the patient. And then when they finally get it and they're motivated, then you see the change.
So if I'm going to attain wealth, let's say I have a very good background in finance, good at it. I have a skill, a talent in finance, and I can do investments well. And in order for me to maintain, to acquire that wealth, it means I have to have knowledge of what I'm doing. In order to maintain that wealth, it means I've got to continue to learn.
Yes.
So here's what I'm thinking. If health is wealth, and we educate ourselves about health, we can maintain wealth or the health.
All right, you're getting me all mixed up now.
So in other words, I'm saying we have a responsibility to educate ourselves, because the practitioner, the physician, the doctor does not have enough time to give you this education. Unfortunately, the system doesn't allow for that. You know, most of you have the experience of going into your doctor's office. You don't have the luxury of hanging out in the doctor's office for 1 hour or 30 minutes. You know, most of us, we're getting 15 minutes, right? And because of that, there isn't enough time to do this education. So we have a responsibility to ourselves. We have a responsibility to learn about our bodies and to understand what's happening in our bodies to maintain this wealth.
But Floyd,
of health.
As the Adventists though, listen, we were way ahead of our time through the prophetic writings of Sister White when it came to our health. Honestly. So we really have no excuse as Seventh-day Adventists, practicing Seventh-day Adventist Christians. We really, Sister White, she was ahead of her time because God gave her the message. So it's just for us now to utilize the message correctly and implement it, because we shouldn't be suffering at all, honestly.
Right.
Like the Egyptians.
So here's another question. So the question that we ask, the question that is the topic of this discourse, is health wealth? I'm going to ask another two-word question. For who? If we agree that it is wealth. But for whom or for who
Okay.
is health wealth?
Oh, well, you want to really do that? So let me just give you a little snippet, brethren, because it's actually on the World Wide Web. I tell my patients all the time, especially those with the metabolic problems like high cholesterol, hypertension, diabetes, the three common ones. I tell them all the time, don't be commodity. I tell them straight up. I said, don't be commodity. You know why? Because let me give you a little quote and you can research it for yourself. Which year was this? This was 2018, Wednesday, April 11, 2018. Goldman Sachs invest in healthcare, okay? They invest in healthcare and they ask the question at this biotech research meeting, is curing patients a sustainable business model, right? Is curing patients a sustainable business model? They ask the question. And they refer to hepatitis C because now there's a cure for hepatitis C. So that's not sustainable and that's not profitable for Goldman Sachs, right? And they're looking at other conditions like cancer, which is profitable. So I tell my patients all the time, listen, our bodies are commodities. We have big agriculture, then we have big pharma. We are trapped in between, and we have big companies like Goldman Sachs profiting from healthcare, saying there's a cure now for hepatitis, so it's not a sustainable business model, and they can depend on cancer. So that is very sinister. And some of us practitioners, especially the functional practitioners, they have been blowing the alarm, shouting from the rooftop that we have to pay attention to our health. It doesn't matter at what age we begin, but we have to. And that's the Adventist Christians, I'm telling you, it is dear to our heart because we know better, right? We shouldn't have to allow people from coming in from the outside to give us this message that we already have.
So it's safe to say that healthcare in its purest sense does not make money. Sick care does.
Mm-hmm.
All right. Now,
Mm-hmm.
now it begs a question then. What are we to do? Because we shouldn't make we yes, we can make an argument that others shouldn't profit from
Mm-hmm. Or illness. Mm-hmm.
right? But that's the world we live in.
True.
That's just a fact based on what you just read.
True.
If investment bankers are investing in health, they're looking for things that will make money.
Mm-hmm.
And if you are reversing a disease and you become you are not dependent on medication,
Mm-hmm.
it means that some people aren't making money.
That's the truth. And we're
Or
talking about illnesses, lifestyle illnesses, because some, honestly, we can get sick because this is Earth, this is planet Earth. So we're talking about lifestyle illnesses, the ones that we can avoid.
right. So, and again, and the most common ones are the hypertension, diabetes, and high cholesterol. Now, what is our responsibility? If we want to be healthy and be wealthy in that health,
stay curious, ask questions, research.
So we have to understand for ourselves what our body is telling us. It always wants to tell us what's wrong, but are we listening?
And don't be afraid to ask the question when you go to your primary care provider. Ask questions. Don't be afraid to talk up for yourselves. Ask why. I know we have only 10 minutes with each patient, but ask why. Right. Just don't take it like that. Ask why.
So there's an opportunity there. Inform yourselves, be knowledgeable, because there's information. There's information out there for us to understand. Do your annual checkups, make sure that you understand what your body's telling you based on the lab work, and eat to live while living to eat, because both you could do both at the same time, right? The body is designed to heal itself, and if you give it the right ingredients, it will. Our responsibility, invest in our health, right? I think we invest in our 401k, we invest in our homes, we invest in our businesses, right? And we do all this investment, but many times and on many circumstances, health becomes last place. It takes last, invest in health, mental wellness, physical wellness. It's
and spiritual,
important,
and
and
it's tidy.
spiritual, right?
Spiritual as well.
When you think of someone who is wealthy, we can see wealth displayed based on what they drive, what they wear, where they live. But health sometimes
is not seen.
Sometimes, yeah, it's not readily seen. I mean, it's seen, but the importance, I think, where you live, because I tell you why. Some time ago, there was a YouTube video I watched of a gentleman living by the beach, right? He had his own little hut. He would get up, fish. I believe that's a wealthy guy. Based on where he lives. I mean, and he was well up in his in age, I would say. But he's a wealthy guy because he was looking good. You could see the what you call it, that burst of health in his face. He was happy, he was content. He said it himself. There's some things he can't afford, he wish he could, but he's content. But conventionally, we would look at him as being wealthy because he's not living in a big house, but he's healthy and he has wealth and he's content. So we've got to invest in our health, change our mindset about health.
Yeah.
Right? It is the most valuable asset we have. And it's the most valuable asset we have.
How do we go about doing that? I tell everybody, eat whatever we put in our bodies. Remember, from the last time we spoke, we spoke about the environment, but let's talk about food. We have to make sure that the food is coming directly from the soil. So when we look at an orange, it is an orange with no other ingredient. When we look at if we go to the store and we buy something in a wrapper, we're going to see multiple ingredients. Make sure that our food is close to the soil as much as possible. That is it. I know we're out of time, isn't it?
2.5 minutes to go. Just about.
Yeah. Make sure that the food is as close to the soil. I know we have organic, inorganic. Who knows if the organic is even organic? And we have all of those questions. But eat as clean and as close to the soil as possible. Right?
Yeah. And let's understand this, that eating right, exercise, just maintaining that health,
7 laws of health,
really requires sacrifice, right? It's not an easy road, so to speak. However, the benefits are enormous. And again, this is not to say that we won't get sick. I believe what it says is we're giving ourselves a fighting chance, right? Investing requires sacrifice, and we get that. And, change our mindset of how we understand success. It is not only what we have achieved, but also the state of body and mind.
That's it right there.
The state of body and mind. So we have a minute left. So in conclusion, we can safely say that yes, absolutely, health is wealth.
Health is wealth.
And we ought to treat it as such. And God requires of us to do the best we can with what we have.
With this, treat his temple well.
yeah, much like what God has given us. If we take the time to understand what we have and to treat it, to keep the temple of God in good condition, we'll be blessed for it, and we'll maintain that wealth
So we just
of
gotta
health.
just give the body a fighting chance. I know we're not gonna live forever because of the sinful condition of man, you and I, but we can try to avoid these chronic conditions, and we can try to have a quality of life and not to suffer unnecessarily. Mm-mm-mm.
Absolutely.
Mm-mm.
All right. Well, I think time is up, and thank you very much for listening. I'm not sure if there are any questions.
Yeah, this is very, very good. I have a question. Like in my case, I had cancer, right? I mean, I don't eat anything like that, like no meat, nothing like that. Like canned food, I mean, maybe once in a while. Very, very healthy. Like I don't eat anything like I mean, vegetable, fruits, grains, nuts. And I still got cancer. Very rare cancer. So I mean, what do you do when you have done everything that is required of you? Like,
Man,
what do you do? And you still get it.
James, listen, this is where our DNA throws us a curveball, man. This is where this is where now, and listen, but James, can you imagine if you weren't doing everything, if you weren't doing the right thing to begin with? Think about that. So it's no guarantee that we won't get smacked by these diseases, because remember, we're on earth, right? But can you imagine if you weren't shoring up your body initially? What would have happened to James? You get what I'm saying?
Yeah, yeah, I get what you're saying. Yeah, to me, I think it's just the work of the devil. I wish I had time to go through everything, but I just want to give good news, and we all know about it. I said this before, like 100% cancer free. So,
Amen.
uh,
See?
and in my case, I had to go through. We did prayer, but I had to go through surgery. I had to go to
Yeah.
doctors. So there's time where you got to balance the two. So.
Yeah,
Man, to
absolutely.
God be the
We've got
glory.
to balance the two.
Mm-hmm.
Absolutely.
I
To
have a
God be the
question.
glory.
My question, are we defining wealth as having almost a perfect body? It's not to be confused with money. Well, that's correct.
So let's see if I understand. If we're defining health as being in
No,
a state,
if we're defining wealth as a perfect body of no disease.
No. Mm-mm.
no,
Two
not
different things.
yeah, because what is we're all at different stages of health, right? There are different things that affect us, but it's the body environment that allows the state of mind and body that allows you to um, be engaged in some kind of healing,
Mm-hmm.
right? Again, we're living in a sinful world, and there's no guarantee that we won't get sick.
Mm-hmm.
Just as we're driving on the road and we could do everything to be safe and still meet in an accident, right? But it doesn't mean that because we might still meet in an accident, we'll drive recklessly. We're still going to do drive safely, pay attention to the traffic laws, because that's the state we're in. So yeah, the wealth is just where you are in your personal health journey. There's some things that we won't, we can't, as you get older, there's certain things that definitely happen.
And then can I butt in?
Go ahead.
And then health can be
Let me be clear what I'm trying to ask. There's a person who's completely healthy, no issues, no medication, but doesn't have any money.
Oh, that's what you mean. Oh, okay.
Yes.
Got your brother Aubrey.
Okay, okay. Yeah, I think they're two separate things.
Yeah,
there's a physical wealth, and then there's that.
And then you have the gentleman who has all the money in the world and no health.
Correct.
And they're pining at each other like, I wish I was healthy. And the man who is healthy is who it's a state of mind. And the man who is healthy is like, I wish I had some money. But they are two separate issues though. But at the same time, we need to be healthy. And health is different for everybody. Let's say, Brother James, if we can use your scenario, you're pretty healthy right now. But you went through something and your body had to fight. Right. Yeah? So you're healthy right now, while some of us are here, like myself. I don't know if I have any I might, but I don't know what's going on totally 100% in my body. And I'm feeling pretty healthy right now. So it depends on what's going on. Health is different for everybody. Some people are diabetic and they're able to function. They're healthy in their sphere. So it's not a one glove fit all when it comes to health. Some people are paraplegic and they're doing well, but they're okay, right? So we won't be perfect because we got to remember that we're in a war zone and we're gonna get hit with shrapnel, right? Because sin is like all around us and we're gonna get hit. Remember that pronouncement on us? Until Jesus comes for us and gives us a new body. We're gonna be in this war zone. Okay, what time is it now? 8:12.
All right. Any more questions? At least this is very, very good. Any more questions?
I just have a quick comment. To go back to going to the doctor and they don't have much time with us. One of the things that I do for myself, and my doctor loves to call me Dr. Google or Google Doc. When I feel my symptoms, I go online and look them up. So when I go to my doctor, I said, do I have COVID? Do I have flu? Or do I have because these are my symptoms. Is it my sinusitis? This is where it hurts. So if we know our bodies, we can tell them what's wrong with us and they can work from there. That's what I do. And it's funny because my doctor's like, okay, what's wrong with you now, Sakasha? And I'll tell her what's wrong with me. And she's like, well, it's not really a cold. It's your sinus this time. But I give her the indications that what I'm feeling. And I give her something to start off with. So I think if we as people know our bodies and know what's wrong with us, instead of going to the doctor to try to find out what's wrong with us, it will help us along the way in our short 10, 15 minute visit.
It's unfortunate that we have such a short time, but it is what it is. And that is so really helpful. I'm sure your provider love you for that.
Oh yeah, she busts my chop all the time. Even my gastro. When I go to my gastro, doctor, this is my journal. This is what's been happening for the past 3 months. I haven't seen you. Here is what's going on. Where are we? I go to see my physiatrist. This is what I've been doing to keep myself healthy. We have to do that. And if it's mental journal, we might forget something. But if we write it down in our physical journal, it will help us when we get there, because then they'll just look at the journal and say, okay, this was you had a flare here. Okay, you didn't have a flare here. Beautiful. The medication is working. You can taper it off. I help myself for them to help me.
Beautiful, beautiful, beautiful. You know.
Thank you. From a medical perspective, from medical providers, thank you for saying that, because sometimes
yes,
we don't hear that all the time. But thank you.
Oh yes, oh yes.
Amen. Amen. Praise the Lord. Excellent. Anybody else have any other question? No other question?
I just want to thank them for the presentation.
Yes, Sister Max is going to do that. But thank you, Brother Tompkins. No other questions?
And was it Pastor Bulgin that was online, or Pastor Bulgin that's in Georgia?
Yes.
Oh, where is Pastor? Is he still there?
No, he left.
He left? Oh, okay.
This is George Bulgin, not Samuel Bulgin, but George.
Wait a minute, which one is it? Is he with the Cumberland Conference?
That's his brother, Samuel.
Oh, okay, no, okay. I'll get mixed up all the time. Okay.
Yeah.
Yeah.
All right. So,
All right.
yes, thank you, y'all. We appreciate you guys.
It was
Amen.
a pleasure.
Sister Cole,
Yes.
Sister Sylvia.